Meningiomas are the most common benign intracranial tumor. They originate from arachnoid cap cells, which are cells within the thin, spider web-like membrane that covers the brain and spinal cord. The arachnoid is one of three protective layers, collectively known as the meninges, which surround the brain and the spinal cord. The other two layers of the meninges are the dura mater and pia mater. As meningiomas may remain asymptomatic for long periods of time, they are often an incidental finding. Tumor compression can lead to a wide variety of neurological symptoms like headaches, seizures, paresthesias that are generally specific to the structures being compromised. Contrast imaging typically shows an enhanced round tumor with well-defined margins that often resembles a snowball. A 46-year-old woman is brought to the physician because she complains of vision changes that have been slowly progressing for several months. Other than changes in her vision, the patient has no complaints of nausea, vomiting, or headaches. Physical exam shows changes in visual acuity. Fundoscopic exam is normal. The patient has a CT scan of the head, which reveals a homogeneous mass on the left aspect of the sagittal sinus. What is the most likely diagnosis? The location of the lesion on MRI scan is typical of a meningioma. Meningiomas are usually benign, slow-growing tumors arising from the arachnoid cells of the meninges. They are accounting for approximately 30% of primary brain tumors. The second common brain tumors are gliomas. What are the risk factors of meningioma? Meningioma is about 3 times more common in women than in men. The tumors are most common in older patients, with the highest rate in people in their 70s and 80s. The cause of meningioma is not completely understood, but there are some risk factors. 1. Receiving radiation therapy. 2. Having neurofibromatosis type 2, a rare inherited nervous system disorder. People with neurofibromatosis type 2 often get benign tumors of the nerves throughout the body. Where are the lesions associated with meningiomas typically located? Meningiomas may be found anywhere along the dura, but most often in the superior parasagittal falx region, cerebral convexity, sphenoid wing, olfactory groove, and posterior fossa. Other diseases that commonly involve the dura include lymphoma, metastatic carcinoma, and tuberculosis.
What are the histologic findings of meningiomas? Meningiomas display psammoma bodies in elongated spindle cells arranged concentrically in a whorled pattern. Psammoma bodies are laminated concentric calcified concretions formed by meningiomas, head, papillary adenocarcinomas of the thyroid, neck, malignant mesothelioma, thorax, and serous papillary cystadenocarcinoma of the ovary, pelvis. What is the treatment for this meningiomas? For small, slow-growing, and asymptomatic tumors, careful observation is appropriate. Surgical resection is indicated for symptomatic tumors or quickly growing tumors. Complete resection is often curative. However, tumors can recur if incompletely resected. What other symptoms are common in patients with meningiomas? Because of their slow growth, many meningiomas are detected incidentally after neuroimaging for other reasons. However, large tumors may displace normal brain tissue and cause focal neurologic deficits such as visual disturbances, hearing loss, mental status changes, extremity weakness, obstructive hydrocephalus, and/or seizures.